This radio show is brought to you by All-In Cincinnati. All-In Cincinnati, an equity coalition, is sponsored by BI3, Greater Cincinnati Foundation, the Carol Ann and Ralph V. Hale Jr. Foundation, Fifth Third Foundation, Interact for Health, and the United Way of Greater Cincinnati. Thanks for tuning in.
We're rolling together now. We're rolling together now.
Hello, and welcome to the All-In Cincinnati Radio Show, where we are all in it together to eliminate disparities and inequities for Black women in Hamilton County. I am Denisha Porter, and I am honored to serve as the Executive Director of All-In Cincinnati and your host for our segment today about a dire situation, drugs in the Black community. In 2016, the Hamilton County Coroner's Office reported 47 overdose deaths of Black people. In 2021, that number jumped 187% to 135. While incidences for white people are significantly higher, the growth rate for Black people is alarming. Trend data illustrates a positive change or reduction in death rates for whites, while Black people have exhibited no significant change or reduction over that same period. The CDC reports similar trends nationwide. According to a 2023 Enquirer article, death rates for Black people rose when fentanyl became the dominant opioid on the illicit drug market, as it is frequently found tainting cocaine and other stimulants. The earlier wave of the opioid epidemic stemmed from prescription pain pill misuse, then moved to heroin use, which primarily hit white communities. Worsened by disparities in healthcare, the criminal justice system, and other systemic racial inequities, the opioid epidemic is becoming a crisis in the Black community. Today, two guests are on the front lines of the opioid crisis in Cincinnati. Our first guest is Rashida Pearson, our harm reduction service coordinator at Caracol, and an overwhelmingly advocate for addressing the systemic inequities that make it difficult for Black Cincinnatians to live drug-free. Our second guest is Jeralyn Boyd, a clinical social worker and therapist specializing in substance abuse and addiction. Patients can be open and honest while exploring skills and innovative ideas to make positive changes. Welcome, ladies, and thank you for joining the All-In Cincinnati show today, discussing the near crisis about drugs in the local Black community. I invite both of you to introduce yourselves. We'll start with Rashida.
Hi, good morning. Again, my name is Rashida Pearson. I work for Caracol. I'm a harm reduction service coordinator. I've been with Caracol for about a year. My professional background is working in mental health with transitional youth.
Awesome. And Jeralyn, can you introduce yourself?
Sure. Hi, I'm Jeralyn Boyd, and I am a clinical social worker in private practice. So I just work for me, which is wonderful.
Yes.
I specialize in mental health, substance use disorders, and also addiction, and just really having brilliant and beautiful conversations with people. And so, to figure out how to kind of work through and get through some of the things that we're going through. So I'm thrilled to be here. Thank you for having me.
Yeah, thank you for coming. And I love the way you set the stage. You said brilliant and beautiful conversations. So I'm hoping that's what we have today.
Oh, I'm sure.
So tell me, what's happening in the Black community with drugs right now? We want to start with Jeralyn?
Sure. Everything.
Yeah.
Everything is happening in the Black community. But I think what we're seeing mostly, these upticks and overdoses, is because everything is being cut with fentanyl. Mm-hmm. And so you could just do your regular line of cocaine recreationally, and what you don't know is that it's laced with fentanyl. Mm-hmm. And you can very easily end up overdosing and dying because you don't know what you're using. Right. And so we're seeing, or in the community, what's being seen is that fentanyl is just everywhere. They're cutting everything, lacing everything with fentanyl, which is 100 times more potent than heroin. Mm-hmm. And so, if this is not something your body is used to, it's very easy for you to overdose. So I think not all of it. Some people are directly using fentanyl or heroin. Mm-hmm. But I think a lot of what we're seeing in the uptick is that we're just saturated with it.
Right. What about you, Rashida? What are you seeing right now?
I am seeing a devastating amount of African American men and women dropping like flies. African American men. There were a higher rate of African American men opioid deaths over white men. Right now, we have exceeded the white community in opioid overdoses here in Hamilton County. The white community numbers are decreasing while ours is increasing. What I see is why the epidemic was going on in the white community. There was no education or awareness brought to the African American community about fentanyl. Period. It was a white problem. That's the way it was promoted. When we saw billboards in the community, like getting off the expressway, it was a young white man with a hoodie on. Now, I don't know if you all are aware, but Walnut Hills has the highest opioid overdose rate in the state of Ohio.
Wow.
There's no billboard. So when I'm working in harm reduction, and for those of you who don't know what harm reduction means, it simply means to meet people where they are, with no bias. Right? You treat them with dignity.
No judgment.
With no judgment. With humane love. Right? That's how you treat someone that are, whether they're homeless, whether they're on drugs. That's what harm reduction is. In the African American community, when it comes to drugs, from my perspective, we step over our folks that are on drugs. We kick them out of the house. We push them away. We don't really encourage treatment. It's just like you're out there on your own. And I don't know if it's because of the lack of awareness for resources, because there are resources. I don't know if it's because of the way we were treated during the 80s, during the crack era, right? Society threw us away, locked us up, treated us like animals, right? So we have all of these layers of how drugs are perceived in the Black community, this huge stigma that's associated with it. So that's what I'm seeing. I'm really concerned about our children, right? Because fentanyl is in these counterfeit pills that are coming from Mexico. They're all over the United States. And Percocets, Molly, that's all in music. It's part of hip hop culture, right? And so you might have a young lady who don't pop pills all the time, but she hooks up with a young man and they going out to hang out for the night. She got a couple kids at grandma's house, right? And she don't make it home to them kids. These are the stories that I'm hearing as I'm out doing outreach in the community. The other piece that I'm seeing is when the toxicology report comes back and the parents learn that their child overdosed as an opioid overdose, no one's in the community is talking about it. I think there's shame associated with it. And we need more of our community to start speaking out about these casualties that's happening. Because if we don't, it's only going to get worse. So that is what I'm seeing, in that I don't want to wait for some entity to take charge to address this. This is a community issue. It should be a community effort. And that is what I want to speak on today.
Thank you so much. You talked a little bit about the counterfeit pills, but how are we being exposed to these drugs? What are additional ways? So I think, Jeralyn, you talked about it being laced in cocaine. Is it being laced in other drugs? And what are you seeing?
Yeah, and so, yes, I agree with everything that Ms. Rashida spoke about. And so the one thing, like these counterfeit pills, is that you cannot tell the difference between them. You can lay them side by side with a Percocet, a regular Percocet. You can't tell the difference because they can press them exactly the same.
Oh, wow.
Yeah, so it's a lot of trickery, I guess. And because fentanyl is so addictive, we want you to be hooked on fentanyl. Does that make sense? So we're going to get everybody hooked on fentanyl because this is the big thing. And so, but yeah, the community stigma, right? I think one of my biggest missions is about stigma and mental health and substance use disorders and addictions of all kinds, because we're all a little bit addicted to something. So addiction is addiction is addiction. And so, but to bring awareness to and be able to talk just very casually about, and, the dignity part. We all have stuff. We all have stuff. But I think with substance use disorders or addiction, we look at it as a moral failure. As a moral I couldn't get moral.
That's
out.
okay.
As a moral failure. If you're addicted to drugs, then it must be something wrong with you, right? How could you be so weak in order to let this happen to you? How, all of these questions, when it could just be we were partying, right? Party drugs, right?
Party drugs.
No longer party drugs.
No more party drugs.
Right? Where it used to be, you hanging out with your girls, you hanging out with your boys, we get lit, we go out. Yeah, not so much anymore. But if we're not talking about these things, or if we're not comfortable, if my daughter can't come to me and say, hey, this is what I'm doing, and I say, let me tell you about what's going on out there, right? So if we can't have these conversations, because if my mom condemns me for party drugs, or if my mom or my dad or whoever, right, I'm talking to is not well versed, and we're not. Normal households are not well versed on drugs. Normal households are not well dressed on sex.
Yeah, that's true.
We're not well addressed with these things, so we don't know how to talk about these things. But these are the things we need to be talking about with our children.
Right. How do we open up the dialogue then?
Go.
Well,
You go.
I want to go back to the question about the drugs. Fentanyl is in all street drugs: crystal meth, crack cocaine,
Marijuana?
We're gonna put marijuana to the side real fast, right quick. You have not just Percocets, Adderall. We had two students from Ohio State died from buying counterfeit Adderall.
Wow.
I don't know, but there was just an Adderall shortage. So, yes, there was an Adderall shortage from the pharmaceutical companies. How coincidental is that? But we're going to leave that one alone too. So when you think about all of the street drugs, these are coming here from Mexico with fentanyl already laced in them. Now, there are some folks that are pressing their own pills locally, but the majority, the bulk of those drugs, they're testing it. Like if they were to snatch drugs from the Mexican cartel being transported here in the United States, they're testing it. These pills are already coming here with fentanyl. Wow. Also, you have to understand, because I host syringe exchanges, right? We partner with Hamilton County. We host syringe exchanges. There's a lot of white folks that are looking for fentanyl. They want it. You understand what I'm saying? They have their tolerance, and they know that if they test their drugs and fentanyl is present, because there's fentanyl test strips to test their drugs. We'll get to that as well. They know to lower their dose. They know to call someone to say, hey, I'm about to use. I have this Narcan. Come check on me in 5 minutes. It's a whole, yes.
Wow.
Yes, understand. So they know how to safely use drugs, right? That information is not out there because we're not aware that the fentanyl is in our drugs anyway. Do you see what
in the first place?
Do you see how the disparity is? So you have harm reduction service coordinators such as myself educating folks on how to safely use drugs at the syringe exchanges. But what about the folks that are using crack or crystal meth? Crystal meth is very popular here in Walnut Hills as well.
Yeah, they're doing a lot of speedballing with, they're actually selling crystal meth and fentanyl at the same time, right? So if I get too high if I get too low off of the fentanyl, then I can use the crystal meth to bring up, so which is called speedballing. And so a lot of times they're selling these things at the same time. So you have a rise in both.
Wow.
Oh, yeah, the drug community. So if you don't know any, and I think we don't want to kind of get into this discussion because I really don't want to know that my kids are using drugs. I really don't want, you know. So we have to open up and just love people, right?
Yeah.
Meet people
Where they are.
and not judge them about where they are, because my job is to pull you up from where you are to where I am.
Right.
But I can't do that if I'm judging you.
Right.
And I can't do that if I'm condemning you.
Right.
Right?
Yeah.
So that's so Miss Rashida is in the community. We're gonna have to get together because I got to come out. Right. Because now people come to me and we can sit and have these conversations. Right.
Right.
Yeah.
I love that. We're gonna take a quick break, and then when we come back, we're gonna talk about how we can open up that dialogue. All right. Thanks.
Caracol is Greater Cincinnati's nonprofit organization dedicated to positively changing lives in the fight against HIV. HIV has not gone away. There is still a vital need to raise money, increase awareness, combat prejudice, and improve education so we can end HIV altogether. Caracol offers clients HIV prevention, housing options, and case management services. The organization's overall mission is to be a relentless force in health equity, and promotes health and well-being through HIV testing, PrEP access, harm reduction tools, and sexual health education. In housing, Caracol offers permanent supportive housing and short-term assistance to prevent homelessness and to stabilize people living with HIV. Free confidential case management services is also an option for individuals who need support in medical care, assistance with the cost of HIV medical bills, or referrals for substance abuse or mental health services. Call 513-761-1480 to speak with an intake case manager today.
All right, welcome back to the All-In Cincinnati Radio Show. Today we have Jeralyn and Rashida. So I want to kick it back over to you, Jeralyn. How do we open up conversation and dialogue, especially with youth?
Just by asking, so what's new? Being in constant contact with the people around you and asking, hey, have you heard about this? Just like while we're playing cards, let's just talk about fentanyl.
Oh, yeah.
So just as regular as possible so that people don't become...
Like you're just doing something regular and then you're talking about it, not like, let's sit down, let
me talk to you about this thing.
Right.
And it's like, no, so have you heard about what is happening in the community? What have you guys heard about all of these? Have you heard that, these people? So just kind of like, let's just talk about it. Let's just talk about it, right? Let's just see, what do you know about it? Let me tell you what I've heard about it. And because of what I do for a living and, everybody knows what I do for a living. People tend to be I can talk to people easily. People come to me with the most random things, which is pretty cool, right?
Yeah.
That they trust me with these things.
Yeah.
But my advice to just regular households is let's just talk about it. So we're washing dishes, we're making dinner. So what do you know about? Any of your friends use party drugs? Have you heard that, right? Just putting information out. Your kids will be like, oh my God, did she just ask me about Molly, right? But as you go, let me tell you what I heard today on the radio show, right?
Yeah.
Have you guys heard about this? Oh my God, my mind was blown when I heard about this, this, and this. So just making things commonplace, having regular discussions with your children about everything, which we should be doing, right? We should be talking about sex. We should be talking about drugs. We should be talking about all of these things that are taboo.
Right.
And so for me, it's just, I have 6 children. So I've been married for 34 years.
Yay! Congratulations.
And thank you. And these babies. And so what they come now with, Mom, let me tell you about this thing. They bring everything to me. It's a blessing and a curse.
No, I get it.
But what we always did was we just talked about everything. We talked about music, right? I never censored music. So we have to talk about these lyrics. This is entertainment. Let me tell you what you're not going to do, right? So we just create these very normal conversations. But for me, it's just like, hey, did you hear about... Have you heard this, right? Like Miss Rashida is like blowing our minds with these statistics, right?
Right.
Let me tell you what I heard today. Have you heard this? Right? And people will say no. And then you can tell, and then we can Google. So we're in the information age. So you don't even need to know facts.
Right.
You can just Google it and say, have you heard this? So for me to open the conversation is just to open a conversation. Let me tell you what I heard today.
All right. So, Ms. Rashida, what have you heard? I know you said it was a couple of things that you wanted to talk about a little later. Can you shed some light?
For the young people, I use music because I facilitate groups. So I do use music. I like to use Kodak Black. He made a song called Gremlin. And Gremlin is basically a Percocet laced with fentanyl.
Oh.
and he raps about how he took it anyway. Yeah. And then I like to reference celebrities that we lost due to fentanyl, like Prince. Oh God, what's his name?
Just recently, it was
Coolio just died.
Oh, Coolio.
Well, Coolio died of. Was that drug related?
It was drug related. It just came out. It was
I'm not
They found
surprised. I'm not
fentanyl,
surprised.
fentanyl, cocaine, and
In his system.
methamphetamines in his system.
Really?
And then the young man who played Omar in The Wire
Oh,
died of a fentanyl overdose.
Really?
Little Peep. He was
Oh
a
my
hip hop
God,
upcoming
Blist.
hip hop artist. Mac Miller. Mac Miller. Yeah. So it's been big Grizzly. I still haven't really heard his music, but a lot of the young people are familiar with him. They told me about him. So so music is my go-to when I'm talking about youth and drugs. Let's see. And to go back to the marijuana, there's really not much research out to support whether smoking marijuana laced with fentanyl can cause an overdose or not, right? So when I'm out in the community and I'm engaging the police officers or whoever, the cops are telling me, or we're responding to calls, and I had a few cops, and all they had was a joint and they overdosed, right? Somebody went and copped some marijuana, roll their joint, they're rolling and smoking, they get it to the light, they overdose, they die, the police found them like that, right? So when I'm talking to folks in harm reduction, right, and when I'm at these meetings, they're like, well, you can't overdose off of marijuana with fentanyl. And I'm like, show me something telling me that you can't. So they can't. So best practice, test all your drugs. Marijuana is probably the most common drug that we use as African Americans. I will not go out in the community and promote that you can't overdose off of fentanyl being on your marijuana until I absolutely can see some research showing me otherwise. So my message to the community is test your weed. If you're not getting marijuana from a medical marijuana supplier, test your marijuana. You can get free fentanyl test strips from the Hamilton County Public Health. You can get free fentanyl test strips from Caracol. I'm currently partnering with Hamilton County Public Health, where we're trying to go into the beauty salons, barbershops, and bars and clubs and put little jars on the bars where you can grab a couple fentanyl test strips to test your drugs. And I have a tutorial on how to use the fentanyl test strip on YouTube. It's a step-by-step. It's me giving instruction on how to use it. You can just YouTube Caracol fentanyl test strips, and it'll pop right up. So that's what I wanted to say. As far as the pills, the pills with fentanyl is real tricky, and crack cocaine. The fentanyl is chocolate chip inside the pill. It's chocolate chipped inside of crack. Think of a cookie. When you hold a chocolate chip cookie, you can see the chocolate chips on the outside, right? But you can't see them on the inside. You only know when you bite inside of it or you break it. So when you're testing a pill or you testing crack cocaine, you're going to have to break that up, right? You're going to have to break it up, and whatever baggie you broke it up in, you remove the substance and you test the residue. You're testing residue when you're testing for fentanyl. You don't test the drug itself. So if you're testing for marijuana, you're testing the residue that's on the marijuana. You're not taking pieces of bud, putting it in water, and testing your water. So I wanted to put that out there because I didn't really get to go into detail about marijuana, but there is some controversy revolving whether you can overdose off of smoking marijuana with fentanyl or not.
It doesn't even make sense because fentanyl is also smoked.
That's what I said.
You can still overdose
But what I'm trying to tell you, in the prevention world, when I'm at these meetings, they go back and forth, and I tell them all the time, show me the evidence. If there is no research showing otherwise, best practice, test all your drugs.
Yeah, I
It doesn't
totally
make
agree with
sense to me
that.
either. How can you got to heat up crystal meth to smoke it? You got to
Exactly.
heat up crack cocaine to smoke it. There's been people dropping like flies from smoking crack.
Well, you also smoke
Laced with
fentanyl. They
fentanyl.
also smoke it, right?
They-
It's smoked, it's snorted, it's
It's
injected.
injected, and it's snorted. It's injected and it's snorted. When fentanyl is smoked, it's typically smoked with other things. Yeah.
Okay.
Well, where can someone go if they need help with drug use?
Oh boy.
House.
Cat house?
The cat house is a great place to go.
Okay.
The cat house is often full though. It's got but they have a wait list. For women, it's a lot harder than it is for men. There are a lot more places that men can go than that women can go. But the cat house is a great. I would start at the cat house. It's a great resource. They can also give you other places that you can go. Drug rehab is really expensive. It's really expensive. But a lot of times insurances will cover, depending on if you have medical insurance. But that's a tough one. But getting resources, Currico is a great place to call for resources.
So for where to go for treatment, let's see, Tabor House and the Mental Health and Recovery Board created this African American engagement work group. And out of this African American engagement work group, it's a plethora of community organizations that meet, right? And so they've invited 11 churches to be a part of this African American work group, and they have given these 11 churches funding to create harm reduction programs within their institutions to bring awareness to the community about the Black opioid crisis, right? So Corinthians is one of them. So the goal is if someone was to go to one of these 11 churches and they're ready to go into treatment, they have a list of resources. They have peer support workers that will assist this person into treatment. So this is a new, like a collaboration that is going on in the city. I don't know how the awareness is, the marketing or the awareness is
Promotion of it
is being pushed out there, but
Yeah, because I haven't heard anything about it.
yeah, I'll get you one of
Get me together. Give me
those cards.
Yes,
But
get me
I'm
together.
blessed to be invited to sit amongst this group, and I recently spoke at a pastor's luncheon with several representatives of these 11 churches to educate these pastors more on in detail of what really is going on in our community and how they can help and how they can get the word. So I want to say, like Corinthians is doing, they're providing counseling at the church, and they have like a NA that they offer at Corinthians Baptist. So
you tell people what NA is.
Narcotics Anonymous.
Well, so I want to get back to someone mentioned love and loving people earlier. I think it was Jeralyn. I think you actually might have said that too, Rashida, not throwing people away. So what can families do to support their loved ones struggling with addiction?
Well, education, know what you're dealing with. It's just, we have so much stigma, and I think in the Black community, it just goes even deeper than that, right? Because we have so much pressure to do things right. We have so much pressure to what we look like, just history, right?
Yeah.
We're looked at as less than in almost every other community, so we have to, at least at my house, what it looked like was very important. So for me, it's that we have to take a step back and actually just ask questions. We have to learn, get educated, talk to people, But I think we get so fearful. We get so fearful, and not knowing where to go to get answers or who can I call to talk about this. And we're saturated with mental health and then not so much. So it's like you hear all this buzz about self-care and self-love and get mental health and get a therapist. But then it's like, okay, so how do I get that? Or
Right. That was going to be my next question.
Right.
So how do
and we're not all created equal, right? We're not all created equal. I talk to people all the time like, okay, Jeralyn, I had a therapist, it didn't go well. right? And so, but therapy is like shoes. One of my favorite. It's got to fit. You got to. Not everybody fits with me. People fire me often, but that's okay because I am who I am, and I'm gonna keep it real. Right. And so, because I can't sugarcoat things in order to make you okay. If you are asking for guidance, and if you are asking for help, if you're asking for assistance, I'm down to do that. And but the work is yours, and a lot of people get a little fearful about the work, but you can get anywhere. Call any of the agencies. I retired from the VA. The VA, if you're a veteran, if you're a veteran family, they have every resource. They have absolutely every resource you can imagine to take care of veterans. Talbot House is another one that is just, it's a huge community resource. So if nothing else, they can give you guidance on where to go. People find me every place. I don't know how people but people find me everywhere. So, but you can just call me. You call my phone and we will talk. If I can, we can talk. And it's like we can talk about these things. But any of these huge agencies that are, created to help community can help you with these things.
Okay. All right, we're going to take another quick break. We'll be back to talk with Rashida and Jeralyn. Thank you so much.
The Voice of Black Cincinnati is a media company designed to educate, recognize, and create opportunities for African Americans in the region. The website, www.thevoiceofblackcincinnati.com, includes local Black news, a calendar of culturally inclusive events, a database of more than 700 locally Black-owned businesses, equal opportunity job postings, scholarships for higher education, and other resources to help you live your best life. Connect with the Voice of Black Cincinnati by visiting the website, following them on Instagram and Facebook, and subscribing to their newsletter and text messages. The Voice of Black Cincinnati will definitely add a little culture to your day and inform your decisions.
The All-In Cincinnati Radio Show is back. We are discussing drug use and overdoses in Black Cincinnati with a harm reduction services coordinator at Caracol, Rashida Pearson, and a clinical social worker and therapist specializing in substance abuse and addiction, Jeralyn Boyd. So I want to kick it over to you, Rashida. Can you talk about xylazine?
Yes, xylazine is a tranquilizer. It's a horse tranquilizer, and it's produced and manufactured in China. It's definitely here in Hamilton County. It's really bad in Philly. What it does is it creates necrosis of the skin. So it creates flesh-eating wounds. So I'm seeing it during the syringe exchange here in Hamilton County. So a lot of folks that are injecting drugs are needing wound care because of these really bad wounds, and it's causing amputations, actually. Wow. Mm-hmm. I'm not sure how the xylazine is affecting folks that are that may be laced with pills or coke or crack or meth. I don't really know much, but I do know how it's affecting folks that are injecting drugs. What I don't see is the face of xylazine being transparent across the board. I'm just seeing non-melanated or non-Black folks with the face of xylazine. So what I'm afraid of is what's happened with the opioid epidemic, what's going on with the Black opioid crisis. I don't want them to combat the powers to be to combat xylazine associated with the white community, and the numbers get reduced. They combat it, they get it under control, and now xylazine is now a Black crisis. So this is something that needs to be addressed now in our community. Xylazine cannot be reversed with Narcan. So although someone can take fentanyl and overdose, Narcan can reverse their overdose. If someone was to overdose off of xylazine, Narcan does not work.
Wow. Right
now, there's no way to test xylazine, but they are working on test strips for it. But you can test for fentanyl.
Thanks, Rashida. So how is drug use in the Black community explicitly affecting Black women?
I don't know as far as numbers. I can just, in my practice, what I'm seeing is, because the mother is, I'm pretty sure in probably most households, but especially in the Black community, the mother is the center of everything. And I think the most beautiful work that I do is with mothers, because I know if I can affect change with mom, that change trickles out, right? It's like a baby mobile, right? If you thump the little elephant, the whole thing moves, So when we can get mom kind of working through her trauma and working through her, if drug use is there, because sometimes I just like to drink wine. I just have my bottle of wine with dinner, because it's not always about, cocaine or sometimes it's just you drinking way too much wine, And so, but how we fit is that, once we can do work with mom, it just trickles out. And so how the numbers, I'm sure Rashida probably is better because she's in the community. And so the women that come to me, we do the work on getting mom together. We do the work on getting auntie together, grandma together, and then it just trickles. Then we start talking about things. We start having conversations. And, your question is about how is drug use affecting the community?
Mm-hmm. Black women specifically.
And so what I would say is that when we're looking at, for me, I work also with foster children who have been removed from the home or for whatever reason. A lot of times it's drug use. So it's greatly affecting, greatly affecting in all kinds of ways. When children aren't cared for, when mom is then villainized, and, because we will remove children.
Love on people. Yeah.
I'm telling. And how do we help? And I think a lot of times we don't seek help in the Black community because we are then jailed or the consequence is too high. The consequence. I was reading an article about their now testing. So I have had women who have had their children, Black women who have had their children removed because when they had a baby, they had THC in their system. And then the state will come in and remove their children for THC. But I just read an article that said that now they have this lovely program where they're testing these babies for opioids. But if these babies, but they're not removed. But they're not removed. So hospitals are now asking women if they're using, right? And they can say yes without penalty.
Wow.
So my knowledge, it has never been that. It has always been penalty. There has always been penalty, right? That's why I don't seek help, because there's always a penalty. But, okay, so there's hope.
Okay.
There's hope. Because not only are they testing moms, they're testing babies. And because these babies are going home opioid dependent. And I don't know if you've heard anything about opioids. So there was this whole thing about crack babies. There was this whole thing about crack babies. Crack babies this and crack babies that. And it was always negative. It was always negative. But now we have opioid babies, and they got a nice acronym, but your babies aren't removed. And actually, if your baby tests positive, they will keep your baby longer to get through this withdrawal process, but you're not penalized. So there's hope.
Wow.
But the mom is the central of the home. Mm-hmm. Mothers are the community, right? Mm-hmm. We are. So if something is affecting me negatively, it's going to affect everything negatively. Not only my house, but my community, right? Mm-hmm. And so, but I don't know anything about numbers. I tried to find this information. Once you're I'm on my own, so everything I do is just me. So I'm on my own. I have to find people that can then.
And you guys work well as a team.
But I have to partner with so that I stay abreast of what is happening in my community, because it's me and you.
Right.
What do we, right? So I get very, which is beautiful and brilliant. It needs to be. But I also have to stay connected to the community so that I can see how what I'm doing, right, compares and complements what is being done here, right? So, but I think everything is affected. I know that sounds so general to say everything, but if I am not okay, and I have 6 children and a husband, right? I know they say the man leaves the house, but we can talk about that. That's a whole nother show. But if I am not doing okay, nothing around me is okay. So a visual, the cup, it's a teacup, and then the saucer. Everything in the cup is mine. See, what spills over the side, what lands in the teacup is for the rest of y'all. But we're not taught that. So we tend to give until our cup is empty, right? So if I'm on drugs, right? If I'm drinking too much, if I'm just drinking too much wine, if I just, smoke a joint on occasions, because we tend to minimize some of these things. When you say crack cocaine or marijuana, it's like, it really, addiction is addiction is addiction. If I can't get my work done because I'm smoking too much weed, I may as well have a crack addiction, okay? Because it affects my life the same way. And so if I'm not able to give, though, if I'm not able to let my my cup run over, that affects everything and everybody, right? Yeah. Because what goes in the saucer is what's for you. And I got a lot of you. Right. I got a lot of y'all. That I take care of.
Take care of, right.
That's right. And all of us do, right? We take care of each other.
Take care of the community.
That's right. We are the community.
Exactly.
That's right. So,
yeah. Rashida, do you want to add anything?
I was going to say we're leaving a lot of children behind.
I love you. Always bring it back to the youth, yeah.
I'm just saying the youth is our future.
Right.
We got to get old. Who's going to take care of us? Who's going to be our caregivers when we're older if we don't have children? Who keeps our race moving forward? If we don't have children, our children grow up and have children. That's how our race continues and live on. Our children are so important. I just feel like as a community, we're losing sight of how important our children are. They're very important to our existence. That is how important children are. And when it comes to women, I don't see a lot of women in drug treatment. I don't see a lot of black women. Let me clarify that, because I see a lot of white women in drug treatment. I don't see a lot of black women in drug treatment. No. I have seen and met individuals that are pregnant, that were actively using opioids, and they might even still go to the methadone clinic. And when they have their baby, they go to a first step type of home model where they can still keep their baby. They'll hold their baby in the hospital while they detox. This is absolutely true. And it blew my mind when I said, do you know how many young women I worked with in the past who had opened children's service cases because their babies tested positive for only marijuana? And there haven't even been much research out there to even show harm to a baby for the marijuana use. Like, it was like someone who smoked cigarettes versus marijuana. Same, right? They don't call 2-for-1 kids because a woman is smoking cigarettes pregnant, right? But they were calling. So, yes, that's another disparity. I'm trying to make it make sense. Like, please make it. And what makes it so bad is that we sit on all of these platforms where we're talking about racial inequities and inclusion, but nobody wants to keep it real about institutional racism, because that is exactly what we're seeing across all of these different systems. If we really want to make a difference, that's what we need to be talking about, regardless of what gender, sex, or race you are. Those are the conversations we need to address.
I know I'm going to study to be a doula for that reason right there. For that healthcare, I thought I was going to have to go and become an attorney because of the young women that were telling me their stories about how they've been treated and how their children are being taken from them for something like THC, or you're not smart enough, or you're not properly caring. The stories go on and on. We need a whole nother show for that. And I told my husband, I'm going to have to go to law school because somebody's got to represent the
That
But
too.
you know
My
what?
Juris
No.
Doctorate, I was this close.
But lawyers come after the thing has happened. Like, Jeralyn, you got to get on the before.
The prevention side.
That's right. So I want to learn to doula because I want to be the voice in the room.
Can you tell
where
people what doulas are?
Oh, doulas are everything. But there's several ways you can be a doula. But I think there's 5 areas. So death doula, believe it or not, we can talk about it if you like. Birth doula, sex, someone that's very well versed in sex education, sexual health, and all of these things. And there's also the birth doula, so I can actually catch babies is what it's called. And then there's this person that is the mouth in the room. So there's a mom. I have 6 children. If my husband was not the ultimate partner and had me
Advocate for you, yeah.
Oh boy, did he advocate. So because you see the despair, I saw them. It's not that bad.
How do you know? What I
Okay. So, but if I did not have this person who had who was of sound mind, who understood the mission, right, and could say, "No, come back, let's," right. So that's what I get to be because that's the most important thing is to bridge this gap because of a whole nother subject, which is the death rates of babies and black and brown moms and babies.
We did a whole docuseries
mortality.
on it. Yeah.
It is
Right here in Hamilton County.
With all of the medical, what? So, but that's how to get in on that, to be able to help with that disparity because Black women, we just aren't believed. We just, it couldn't be that. There's so many things around Black. It's amazing we're not all on drugs, trying to deal with and cope with all of the trauma. We all have PTSD. One of my clients said, Miss Jeralyn, all Black people have PTSD. You are right.
This is true.
You are right because look at what we have to do. We have to maintain like everybody else, but with all of these things stacked against us. We're stacked against us from birth. Right? Nothing we've done. But we look at us. We thrive and we survive and we do
resiliency.
our thing.
Yes.
Right?
Yes. Okay, so we're going to take another quick break. We're going to come back and we're going to talk about some last-minute words of wisdom from both of our panelists today, Rashida and Jeralyn. Thank you so much.
Therapy is a place for new beginnings, beginning to learn about ourselves, beginning to increase self-love and appreciation, and beginning to heal. Jeralyn T. Boyd aims to meet clients where they are, with understanding and a strong therapeutic relationship as the foundation. She is a clinical social worker that specializes as a dual diagnosis therapist, which means she works with people who suffer from both mental health and substance abuse disorders. She accepts most insurances and offers online therapy sessions regularly. She primarily serves Black adults and elders 65 years or older. Individuals, couples, and families are welcome. Jeralyn uses cognitive behavioral, CBT, culturally sensitive, mindfulness-based, and motivational interviewing treatment approaches. Call Jeralyn T. Boyd for a free 15-minute consultation at 513-802-9652.
Welcome back to the All-In Cincinnati Radio Show. As we close out this segment, let's talk about what can be done to address the problem of drug use and overdoses in our Black community. So, Rashida, what can be done to reverse these alarming trends of Black people using drugs and dying from overdoses?
Okay, we can start with bringing awareness. We need to start talking about it. I encourage everyone to get their hands on Narcan. As a community, we need to start being comfortable with carrying Narcan. When we witness opioid overdoses, we need to be comfortable using Narcan. We need to be comfortable calling the police. You are protected by the Good Samaritan law. The Good Samaritan law, you will not get arrested. If you are using actually using with someone and they overdose, do not be afraid. Do not leave your loved one, your family member, your friend, your using partner. Do not leave them. Hit them with the Narcan, call 911, or call 911 and then hit them with the Narcan. Secondly, start practicing testing your drugs with fentanyl test strips. Again, they are available at Carico, the Hamilton County Public Health Department. Tabor House has them. You should be able to really walk into just about any of the addiction services. They should have fentanyl test strips. If they don't, more and more are starting to have access to them. At Carico, we have a vending machine. It's a harm reduction vending machine, and it has safer smoking kits, safer injection kits. It has fentanyl test strips. It has Narcan. It's free. It's a free service. I wish I had the phone number, but you can Google Carico and go to their website, and you can sign up for the vending machine, and it's free. It's a free service. You can use it once a week, and you can get all of those items: pregnancy tests, condoms. You can get a sharps container if someone did use needles. So to me, that's really what it is. And to start breaking the stigma and stop being judgmental towards your neighbors for using drugs. Everybody have demons that they're fighting. We need to start loving one another as a community. That is the only way we can get past this crisis.
Love conquers all.
Love conquers all.
It does. I totally agree with everything that Ms. Rashida said. I don't even have anything to add. I think, because it's true, education, talking about things. And we need to educate ourselves so that we're comfortable talking about things.
Right.
I need to be ready to talk about whatever you bring to me. And how I do that is just by reading all the time, always reading. Because but sometimes I get caught and don't know. And there's no shame in saying, you know what, I don't know, but we can find out together.
Right.
Right? So finding how I am combating stigma is by just educating myself. We can all do that.
Right.
We are in the information age. There's everything you need to know about anything is out there. So educate yourself, be comfortable to talk about anything that people bring to you, right?
Right.
And if I don't know, I'm going to say, you know what, I don't know. But we can figure it out, right? So there's no shame in not knowing either. But being love, right? I love you so much that I'm willing to put aside my discomfort to talk to you about this thing. So for me, how we figure it out and combat it and conquer it is just by education. So, and I don't mean in the grand sense of education, but in just knowledge.
Knowledge, right?
Yes, I just need all the knowledge. I want to read everything about it.
All right, Rashida, so what are some national or regional efforts that are currently underway to address the drug crisis among Black residents of Cincinnati?
Well, I'm big on politics, and I'm looking in government and how they are sending funding from the United States Harm Reduction. Let's see, how do you say that? Well, there is a harm reduction, a department, United States Department of Harm Reduction. Okay, and they are sending money to combat the xylazine down the pipelines to different prevention organizations. So there'll be grant money out there. And I suppose to combat the Black opioid crisis as well. I would say look up harm reduction advisory groups. There's tons of them. You can Google them. there's tons. I would volunteer for in prevention. Find some nonprofits that's dealing with people in prevention or in recovery, and just join those advisory groups. If you know somebody who is using, take them by the hand, educate them, tell them what you know about fentanyl. Like if you know someone is using drugs, tell them that fentanyl is in all the street drugs. If you have young people, like be comfortable with having that conversation. Really is a dire situation, because if we don't get the word out, I don't see none of these overdoses being on the news. I run into people every day in the Black community that know someone who has lost a loved one or a friend due to a opioid overdose, and I haven't seen it on the news.
It's devastating.
We're sleeping and we're not paying attention. So we need to start having these conversations as a community.
Right.
So to me, that is what it's going to take on a national level, because this is happening across the United States.
Well, Rashida, how can we get in touch with you?
My email address is rpearson@carico.org. So you can email me. My phone number is 513-227-0164. Carico.org is the website for my agency. Reach out if you are looking for any Narcan training. If you need access to Narcan fentanyl test strips, I can bring them to your organization. I facilitate groups for youth and adults. So if you have an organization, whether it's a nonprofit, a business, give me a call, shoot me an email, and it's a free service. I'll come and educate.
Thank you, Rashida and Jeralyn. How can listeners learn about your mental health and addiction treatment services?
I'm pretty easy. If you find another Jeralyn Boyd anywhere, please let me know. But as arrogant as it sounds, please know that it's not meant that way, but you can just Google me. I'm the only Jeralyn Boyd you're going to find.
Gotcha.
And I think that's how I don't know how people find me. I've never advertised my business. I'm just grateful.
Word of mouth, yeah.
I'm just grateful, right? And so Jeralyn Boyd, JeralynBoyd. Jeralyn Boyd. My number, 513-499-1765. That you, the best way to get me is to text me, because I like to set my appointments back to back. I'm busy. So, 513-499-1765. Shoot me a text.
Okay. You said you like to set your appointments back to back.
I do. I love that.
Okay.
I really enjoy what I cannot tell you. I really enjoy what I do. And also, I have a portal or a website, and it's through Psychology Today. And you can just put my name in. Go to Psychology Today, put in Jeralyn Boyd, and I'll pop up.
Nice.
There is a nice bio there, phone numbers, emails, everything like that for you to get in touch with me as well. So,
and Rashida, go ahead. You can have.
I wanted to throw out there also, Exclusive Services is another prevention. It's a drug treatment and prevention agency located out in Blue Ash. I don't know the number, but it's owned by African American couple.
I do.
Yeah, they've been around for quite some years now. They're a hidden gem in the city, but they have Suboxone, a Suboxone clinic. They do methadone.
That I didn't know that
They
did.
train for CDCAs. I mean, they have a GUGOP. They're in the high schools talking about drugs. So yeah, Exclusive Services. Wonderful. Tracy Riles is the owner of that business, that practice. So yeah.
Awesome. Well, thank you so much, ladies. You did a wonderful job today. And thank you to everyone who listened to our show. Check us out next week. Thanks so much.
Together now.